Hello everyone, welcome to Go Campus. This is Ashwini with you. So, very warm welcome to today's episode. We have Dr. Samuel with us, a dedicated specialty training at Airdrie NHS Foundation Trust. Dr. Samuel's medical journey spans over a decade across multiple NHS trusts. So, from his early surgical training to specializing in women's health, he has built a career marked by commitment, skill, and a passion for improving patient care. Today, we will explore his path into OBGYN, the lessons learned along the way, and his advice to aspiring doctors. So this is what we're going to learn in this episode today. So we have Dr. Samuel with us. Dr. Welcome, and thank you so much for taking time for being with us here today.
Hi, so my thank you very much for the brief history. So my name is Samuel Osieku. I am a specialty trainee in obstetrics and gynecology in the UK. I have been in training for the last almost 7 years now. Prior to training in obstetric and gynecology, I also did some rotations in surgery, which ranged from trauma and orthopaedics, neurosurgery, plastic surgery, vascular surgery. So I've built a lot of surgical experience on the way before entering obstetrics and gynecology. It will be my pleasure to be able to help people who are trying to enter the UK as international medical graduates, which I did myself some years ago, to be able to follow the same path to make it to this level. Thank you.
Thank you. Thank you so much, Doctor, for the brief intro. Doctor has really got a lot onto his profile, but he just made it sound very simple and short. Thank you so much, Doctor. So before we exactly know about doctor's journey into the specialty, we would like, because these are the questions that many doctors have been asking us. So we will start with the questions that we've received mostly from our doctors. Doctor, many doctors would like to know how is the training structure in OBG in the UK, that is starting from ST1 to ST7. How does the training work, Doctor? Can you just briefly tell us about it?
Yeah, so obstetrics and gynecology training in the UK is a run-through training. So it spans over 7 years. So ST1 to ST7. There are different routes of entry. Okay, so you can enter at ST1, which you enter as a foundation year 2 competent doctor, or you can enter in ST3, where you enter as a registrar level. Throughout the years, you have to display some competence throughout the years. At the end of every year, you have a meeting, which is called the annual review of competence, where you display what you have done for the year. So we have a training matrix where you have a lot to achieve within the year. So far as you're achieving what is within the training matrix for every year, then you progress on till you get to ST7 and then you become a consultant.
Okay. And doctor, what are the main milestones or let's say exams that's required along the way?
The training is being regulated by two bodies. It's by the General Medical Council and the Royal College of Obstetricians and Gynecologists. So, they both have milestones that you need to achieve. The General Medical Council just makes sure that you're a safe doctor, and they need to be notified if you get into training. But most of the training is run by the Royal College of Obstetricians and Gynecologists. So throughout the 7 years, milestones, in terms of examinations that you have to attain, the Royal College has a 3-part exam called the membership of Royal College of Obstetrician and Gynecology exams. You need to make sure that you pass all 3 steps. So part 1 tests your basic sciences. So part 1, you need to do it between ST1 and ST2, and it's a mandatory qualification to enter into ST3. And then part 2 of the membership exam, and part 3, you need to complete them by the end of ST5. And that is your qualification to enter into ST6 and 7, which is advanced training.
And suppose if doctors do not complete MRCOG by ST5, they will not progress to ST6. So what happens there, doctor? Do they repeat ST5 again or how does it work?
Yes, so the progression points are between ST2 and 3, and then between ST5 and 6. So, and these are regulated by the examinations, the membership exam. So, for instance, if you haven't passed part 1 by the end of ST2, then you will remain in ST2 till you pass part one. So part one has 6 attempts, maximum attempts if you're in training. If you go past your 6 attempts, then you won't be allowed to take it anymore. In which case, then you might sadly lose your training number. But if you're not in training, I think there's unlimited number of attempts to take the exam. But yeah, for if you're in training, you have 6 attempts. The same applies to moving from ST5 to ST6. You need to have passed your Part 3 exam before moving to ST6. If you haven't, then you stay in ST5. The Part 3 exam has 4 attempts. If you miss all 4 attempts, sadly, then you need to go back to Part 2 and then pass Part 2 again to go back to Part 3. So that's how it works.
So thank you for that, doctor. And we would also like to know how competitive is entry to OBG training compared to other specialties at this point of time in the UK. Can you give us a little insight on it?
Yeah, so it is very competitive. So I was looking at figures for 2024, which I looked at recently.
Mhm.
In the applications for 2024 for ST1, they had 2,170 applicants, and they were competing for 310 posts. So the competition ratio was about 7, yeah, 1 to 7 in that order. So you can see there's a lot more applicants than the jobs available. So these are the problems, yeah.
Thank you, doctor. Now, let's say, like, just to understand the specialty a little bit more, will you be able to tell us what does a typical week look like for you at this stage of training? Like, how does your day start? How busy are you? Can you just give us a little insight on it?
Right. So it is a busy specialty. It's a high pressure specialty. Okay, so you have to be able to work under pressure. So I think that's one of the qualities that they look for in the selection process. So it is really mandatory that you have some NHS experience before you go into training. Recently, there's been a pathway that helps people to go in directly into training if you have like an outstanding CV. But it also has its challenges. It also has challenges because you're in a new system. And most of the time is not about the knowledge because the knowledge you have that from medical school. Yeah, if you graduate a medical school, you assume to have the knowledge. But knowing how things work and where to find things and how to go about different scenarios are things that varies from country to country. In the UK, everything works on guidelines, and these guidelines are national guidelines. But within the guidelines, every trust has their own protocol. So you have to make sure that you work within the protocol of the trust. So you find yourself working long hours. You have to create your own break between the time that you work because you don't have any protected break, which is one of the problems that a lot of international doctors might struggle with because then they might just continue working for the whole, let's say, 12-hour shift without eating or drinking, which most of the local people know how to create their own break and they know that at a point they have to just stop everything and then attend to themselves. So it's stressful. As a junior doctor, you'll be covering the wards. Okay, as ST1 and 2, you'll be covering inpatients. You'll be covering the maternity assessment center. You'll be covering accident and emergency. You'll be the first of call for the GPs and everybody around for advice and for referrals. So as you can see, you're covering the wards, you're seeing inpatients, you're attending to labor ward, and in the midst, your bleep is going off and you're answering all calls from all places. And to even make it, if I should put it like busier, when you become a registrar, then you have to do all that, plus also delivering babies and managing induction of labor. And yeah, so, but the scaling is all about prioritization. If you know how to prioritize appropriately, then you realize that you enjoy the job more. And these are the things that I can help you with.
Thank you. Thank you so much, doctor. That was a lot of insight. Now, the next question that we have, which doctors have sent us, is which parts of OBG do you find most rewarding and which are most challenging? because you've been in this specialty for close to 7 years now. What do you find is more challenging and what do you find is more rewarding, doctor?
What is rewarding? I'll start with the good side. So what is rewarding is that in OBGYN, obstetrics and gynecology, you take care of women from when they have their first period to when they get into menopause. So your care for women is throughout their whole lifespan. So it's nice to see what women go through in every stage of their life journey. The good side is that you see them come to you when they have their first periods, when they're having problem with their periods. You help with hormonal management to try to balance them. If they come in with chronic pain, you help to manage the chronic pain. And if they come in to have babies, it's so nice to be part of that joyous celebration of helping to safely bring a baby into the world. Afterwards, they also see you for all other gynecological problems with your periods and heavy bleeding and chronic pain. And then in the menopause, again, you see them with all sort of like low estrogen problems, which you manage as well. So it's such a joy to be able to help women. So if you have a passion to helping women, and know how much they are worth in society is such a great thing and very rewarding to help them throughout their life journey. Okay. Now, this is all if everything is going well.
Cute.
Every job also has the difficult bits. Sometimes along the line, you try to help and things might not go well. And not necessarily your fault, but sometimes these things happen, and how to overcome them emotionally is also a challenge. Okay, so if you have a bad outcome with any delivery, you didn't go in there to create a bad outcome. You went in there to help. But unfortunately, this has happened. Being able to manage this and developing that resilience is a skill that you and a challenge. So that's the challenging bit of the profession, and alongside moving on to a busy job afterwards. So you have a bad outcome and you're next to the next patient, trying to forget all that has happened and trying to put a smiling face on to help somebody else. So these are the challenges.
Doctor, thank you. Thank you so much for it.
Yeah.
Doctor, now because we just spoke about challenges and what's more rewarding in this career, we also have this thought like, what would you say to young male medical students who are considering OBGYN but feel unsure because of the gender perceptions? Because we feel OBGYN is female dominated specialty. What do you have to say about young doctors who are looking forward to get into this specialty?
Thank you. That's a very good question. So we are trying to encourage more male obstetrician and gynecologists. Um, it helps the workforce a lot, okay, because a lot of our female colleagues along the line might want to have children and they might go on maternity leave afterwards. So there's always gaps within the training rota when one doctor is off for, let's say, a year on maternity leave. However, for the male doctors, you tend to stay in throughout. So that helps to cover a lot of the gaps. In the male in the profession, can have its challenges because culturally, some women might prefer to have a female doctor, especially examine them, and especially obstetrics and gynecology being quite having to perform intimate examinations. It can be a bit challenging. But what you need to know is that you always will have a chaperone, okay, with you. So you have another person chaperone your examinations. It is the patient's choice to decide whether they want a male or female doctor, but you just need to counsel them appropriately to explain, especially in situations where you don't have a female available, because there are times where your consultant might be male, you as the registrar is male, and the senior house officer is male as well. So in that case, then we don't have any female. So in which case you have to explain to them that we will have a chaperone, we will have a female chaperone, and we will consent them before we do anything, and we will stop and they are in control. You stop when they want you to stop. So those are the challenges. It's the cultural aspects. Yeah.
Thank you so much for the insight, doctor. Next question that many doctors do ask us, because we know OBG is a very stressful specialty. Sometimes medical students or let's say even junior doctors who've just got into a specialty who do not have a taster of this specialty yet. Sometimes they're confused. We see them asking us, can they get mentored by a doctor who's in this specialty? I mean, lot many questions that comes up to us. What do you feel like, what qualities makes a good OBGYN doctor? I mean, it's not just from the UK perspective. I'm just asking generally, what qualities should a doctor have to get into the specialty or to be successful in the specialty?
Right, you need to be caring. Okay, you need to be caring as an OBGYN doctor. You need to be patient as well. For example, if a woman is in labor and you're trying to gain consent or explain something to them, you have to remember that they are also in pain. Okay, so if they are in pain, you need to give them breaks in between when they're having a contraction, and not just trying to do your job and getting the information across. You need to also be a bit empathetic, in the sense that if they come to you and they're in pain, say in gynecology, for instance, they are not making it up. They are genuinely in pain and they are struggling every month. For example, conditions like endometriosis, people are struggling with chronic pain and they have been struggling with it for years. So if they come to you, you need to be empathetic, you need to be caring. You're trying to get your knowledge across to them, but in a regulated way, and also make sure that they understand everything that you say. So the qualities are, as I've said, you need to be caring, you need to be patient, you need to be gentle and soft on the woman. So specialty training is a long journey in the UK. It can take up to about 10 years from when you graduate medical school to becoming a consultant. So over here, you do you finish your medical school, you do your foundation year 1 and 2, and then afterwards you apply into specialty training. So if it's obs and gynae, if you manage to get in at the end of foundation year 2, then you have another 7 years of training, so to go through. And that 7 years is not guaranteed to be 7 years. It can be more than 7 years. People go less than full time. People go part time. People also have breaks in between the training to undertake like some special interest out of program courses and diplomas. And for some people, sadly, it might be struggling with exams. They said there are three-part exams which are very difficult exams. Part one is the pass rate for part one is about 25%. Part two pass rate is also about 20%. Part three is about 70%. Yeah. So you see that for most people that take the exam, a lot fail. So you might have a number of attempts. This is alongside the high stress of your job. You're not guaranteed a study leave. So you can't just leave your job and go and sit home for 2 months studying. You have to be working alongside studying. So you'll be tired, you'll be studying, you'll be under a lot of stress. Okay, so but then you need to manage that with other extracurricular activities. So if you're into sports, or if you're into running, football, whatever, that helps you for your mental health, and also sharing all your experiences with your family as well.
Thank you, Doctor. So, Doctor, you've been an IMG yourself. So, for international medical graduates, what's your biggest advice before they apply for ST1 and OBGYN in the UK?
Right, before they apply, they need to have a very good CV. It's very competitive. Okay. They also need to be sure if they want to do OBGYN. So everybody will have had some internship in medical school. Okay, so it's not necessarily having worked in OBGYN, because that is not a qualification, okay, to get into ST1. If it's ST3, they want you to have some experience. But if it's ST1, you don't need to have worked in obstetrics and gynecology before. But at least in your internship years, you will have seen the specialty, and then you see what the doctors go through and then see if it is something for you. Because every specialty has its difficulties, but I think that we in medicine, you end up in a specialty that matches with the kind of person you are. Okay, so you have to know what kind of character you are. Are you very resilient? Most important is resilience in obstetrics and gynecology. You need to be resilient, you need to be determined, and because you go through challenges, but it's being able to overcome those challenges by not giving up is the way forward. Now, the next thing is your portfolio. You need to make sure that you have a strong portfolio. So for international medical graduates, you register with the GMC, so they will assume that you will have done FY1, okay, which is your internship back home. So you enter at like FY2 level. So if you finish your medical school and you've done 1 year at home, then we assume that your 1 year that you did afterwards is your FY2. So the competencies we expect of you are that you're able to clock a patient, you're able to take some history from a patient, you're able to examine a patient, abdominal examination, not necessarily gynecological examinations, because we can teach you that, but mainly abdominal examinations, cardiorespiratory examinations as well. And you need to be able to put in like cannulas, intravenous access, take some bloods. So these are the basic stuff for entering into ST1, which I think most doctors working abroad would have done them. ST3 is much more challenging because then you can enter ST3. Some people come into the UK and register with the GMC. So there are two ways with the GMC. There is the PLAB method where you get the license exam and you enter, or you can also enter after doing your Royal College exams back home. So if you've done your Royal College exams already and you're already a member, then you can enter into ST3. In which case what they will require of you that you need to have done a lot of the obstetric competencies that we need in ST1 and 2. So our training matrix for ST1 says the trainee should be able to do a cervical smear. So you need to be able to have an evidence to show that you can do that. You also need to have evidence that you can do deliveries. So instrumental deliveries like forceps delivery, tooth delivery, cesarean section, you should be able to do them and you should have evidence that you can do them. So what some people, so it will be hard for you to come directly from abroad to enter ST3. You might need to come here, work as what we call a trust grade doctor for a year. And then in that year, you can exhibit your competencies doing all these procedures and get them signed off. Okay, so we have a portfolio which you can register for with the MRCOG, and then you can get the consultants to sign them off. You need to do some audits. So there's a whole lot of things that you need to do, and there's a checklist which I can go through with you.
So, Doctor, apart from clinical skills, as you said, audit is important. Apart from audit, if you have to speak about some strong domains, what else will it be? Audit and?
Okay, is it for ST3 or for ST1?
For ST1, Doctor.
ST1. Okay, so ST1 you need to show evidence that you've done an audit, or any quality improvement project. Okay, you need to have evidence that you have done a year of foundation year and you're able to do cannulas, you're able to do venflons, as in cannulas, do some bloods. Okay, catheters, inserting of urinary catheters. Okay, so all these are the important things.
Doctor, you want to tell anything about the research publication and all that, continuing to that audit?
Yeah, well, research and publications are not necessary. They are desirable, if I should put it in that way. If you have them, they are great for ST3 because that will give you a point above somebody else. Okay, so if it's very competitive, then they look at who has extra points or extra qualifications. So if you do have research, then that's fine. Our UK training is evidence based, so our guidance are all written from research. But there's a whole special team that writes guidelines, so they use those to use research information to write the guidelines, and then we follow them. So you don't necessarily need to have a research degree to enter into training here. There's an academic pathway for that if you're somebody who is keen on it. So it is a plus, but it's not like mandatory.
Okay. And how about the research publication, doctor, or conference presentations? All these will get them some points?
All that will get to give you some additional points over somebody, but they are not mandatory. Yeah, they are not mandatory for you entering.
Mhm. Okay, done, doctor. So I think we've spoken about application, we've spoken about portfolio, we've spoken about what qualities you need to have to get into OBGYN. We've spoken about how is the specialty for men. We've also got doctors' insights on how the career progression in the UK happens. Now we would like to know more about your personal journey, doctor.
Hmm.
Was there a moment in your medical school or early training that made you certain that OBG is your calling or OBG is your specialty? When did you realize this, that it is OBG that you're going to do?
Yeah, so my career interest, I've been through a bit of a change. Initially, when I was in medical school, I wanted to go through the surgery route. So
Mhm.
because I was just a bit more hands-on. Okay, so I enjoyed doing procedures during our internship. So surgery was what I wanted to do. So when I got to the UK, I pursued that route for a while.
Okay.
But equally, I also liked medicine. So I like the fact that of being knowledgeable and getting all that information to make diagnosis, investigations.
Mm.
So I was kind of torn between the two, to go into medicine or to go into surgery, because I like them both equally. And if you want a career that kind of marries the two together, then
Mm.
obstetrics and gynecology is the right
Oh,
one,
very good.
because obstetrics there's obstetric medicine, which we do as part of our antenatal clinics. You
Mm.
manage women with all sorts of medical conditions, cardiac, renal, all sorts of, and even rheumatological conditions alongside in pregnancy. And all these have different effects on pregnancy, on the woman, and also on the baby. So you see, as you can see, you apply a lot of your medical knowledge there. And then in surgery, in gynecology, you can go as high as you want. There's robotic surgery, there's laparoscopy surgery, there's advanced laparoscopic surgery where you do more endometriosis work, and robotics. There's cancer surgery, gynecological oncology, which is a subspecialty in obs and gynae, where they are a full abdominal surgeon. So they do everything abdominally and do not need much support from the surgeons. So you see, you can go to the very extreme. There's urogynecology, where you can do a lot of like urinary system surgery as well. So I felt like I kind of was interested in both, and that's how I ended up doing obs and gynae. But when I started, I did rotations in surgery. So I came in like an international medical graduate. I did my GMC license exam, and then also I went into house officer jobs. So I did in surgery, orthopaedics, and then did rotation in neurosurgery, plastics, vascular surgery, lots of surgical rotations, and all that has helped to build my surgical experience before going to obs and gynae.
Okay, very nice. So, doctor, when you started your career, after how many years did you match to the training position, or was that
Right.
quite fast?
So the training system has undergone changes. And previously, you couldn't get into training unless you had an indefinite leave to remain. Okay, so that was in the time I came, 2013. Yeah, so all you could do was to do trust grade jobs. When training positions come, you can apply, but you are not allowed in the first round unless they can't find anybody in the UK or in the EU to take the post.
I think that's when RLMT was there, right?
Yeah, exactly. Yeah. But now it's changed a lot. So a lot of people are finding themselves getting to training much earlier. Okay, so my journey has been a bit longer because I did a lot of trust jobs. So let's say started working early years, January or February 2014, and then I got into training in 2018. Okay, so I had I can see 4 year period of doing trust jobs, but that has been great for me because that's made my training brilliant because I've got a lot of knowledge that I've moved across and skill that I've moved across and makes me different.
That's nice. Doctor, understanding that OBGYN is a very stressful specialty and you've been in this specialty for so long, is there a time or any time that you felt wish you had chosen something else? Did you have the thought in mind, or how has your experience been in this branch?
Eh, I've not had that experience. Like I said, my other interest was in surgery, but then I spent a good 4 years in surgery before I came into obs and gynae.
Mm,
And it's only been better for me because my surgical experience, I've used my surgical experience in it,
mm,
and I'm also using a lot of medical knowledge as well. There are times where it's very stressful and busy, and then there are times where you think that you are under stress all the time. But from my experience in being in surgery, it was similar. So I don't look back and say, oh, surgery was easier, because surgery also has its stress that you went through. I feel like maybe if I didn't do that and I went straight into obs and gynae, I probably would have been dreaming and thinking, oh, maybe surgery would have been better. But because I had had that experience already,
mm.
so it's just been okay for me. Yeah.
Okay, great. Thank you, doctor. So,
Yeah.
anyone who would like to have a one on one conversation with the doctor, you all know where to head to. That's www.gocampusworld.com. If you wish to speak to doctor one on one to understand more about specialty or to understand what is required to be in this branch, or if you wish to know about MRCOG or how to have career progression in the UK from wherever you are, you can book a slot after a lot of requests. The doctor has opened few slots now, so this is for you. If you wish to talk to him, do not miss this opportunity. Book a session with doctor on www.gocampusworld.com. If in case you have any issues, you're unable to book or you're not able to understand how to book, we are just a call away. Do give us a call if you wish to book a session with Dr. Samuel. So thank you so much for your time, doctor. It's been wonderful talking to you. You've been so kind, so humble, so down to earth in the way you're talking. I mean, really inspiring. I'm sure this conversation will really help aspiring doctors get more clarity on the specialty. And if you fit into this specialty, and I'm sure this will inspire many others in the medical field. Thank you so much for your time, doctor.
You're welcome. It's a pleasure, and I'm happy to help. Thanks for having me.
Thank you, doctor. Have a good day. And thank you, everyone.